This is Matthew Neely, the President and CEO of Brethren Hillcrest Homes in Laverne, or Hillcrest as we know it. I'm sharing this message to all of the residents at Hillcrest, to all of my staff, to board members and other interested parties who may be interested in knowing what Hillcrest emergency response has been to the threat of the COVID-19 coronavirus at Hillcrest. Last night, I was informed that the first death in Los Angeles County occurred at Pomona Valley Hospital, which is our primary acute hospital. And while the individual arrived in a cardiac arrest and was immediately isolated, is my understanding, the threat is heightened because this individual lives within the service area of that hospital that also services our residents. And so we met again today as an emergency response team to discuss that fact and what we can do to mitigate the risk of the coronavirus entering and spreading to residents and staff of Hillcrest. So that's what this short little clip is about, and I'd like to now share with you some of those mitigation strategies. As of tomorrow morning, all meals in the dining room and in the cafe will be served. There will be a streamlined menu made available to residents this afternoon that residents can access, and we will not be serving meals in the dining room or in the cafe area, but those meals will be available for pickup. So if you call in by a certain time, then you will be able to pick up those meals to enjoy both breakfast, lunch, and dinner. In the dining room, it will start tomorrow at breakfast and will include breakfast, lunch, and dinner on an ongoing basis. And in the cafe, we only serve lunch, so that you would need to call in before 10 o'clock. So that is the restriction in the dining areas of the residential and assisted living areas. I will say that if you are restricted to your home by a nurse and would like those meals delivered, that would be delivered free of charge. If you are not restricted but prefer not to go into the dining room, you can pay to have a meal delivered to your home, which is the nominal fee that's already on the additional charges sheets. So if you have a question, please call the dining room on that. We have, more importantly, closed the skilled nursing center to all visitors, including family. We have posted in the lobby of Woods Health Services a station for all staff to check in at the beginning of each of their shifts, and where their temperature will be taken, as it is our understanding that the three symptoms of the coronavirus are temperature, cough, and shortness of breath, and that the temperature is typically the first symptom to show. And so we will screen out individuals through their temperature, and anybody who has a temperature of 99 or above will connect with the RN in charge. And anybody with 100 above will be asked not to report to work that day. That closure pertains to not only Woods Health Services, but also Cedar Court and Southwest Lodge. That is restricting all visitors from those areas, because those are the more vulnerable areas of our campus where the care is being provided to those who are most at risk for either contracting the virus and or being affected by it. So the closure means that all doors, exterior doors, are locked. Now those doors can be exited in a case of emergency by pushing the crash bar, but from the outside, both staff and residents will have to come in the front door of Woods and to be able to access those areas. The transportation department has been affected by these mitigation strategies. All non-essential transportation will be canceled. That includes group trips out to restaurants and other trips for entertainment. Essential trips might include visit to healthcare providers. We are looking currently at strategies for residents who do use the Hillcrest transportation to obtain their groceries, to have them delivered to Hillcrest, or through Hillcrest cooperation with Vaughn's perhaps, or a local grocery store, to have those prepared by the grocery store and picked up either by the resident or by a Hillcrest staff member. We have closed the Aquatic and Fitness Center to not only outside residents, but to our own residents, as the chance for spreading a virus in that environment is higher than average. People use equipment. It would need to be cleaned after every single use with alcohol or bleach-based wipes. And right now supplies are a concern, and we don't know how long the virus will last or the sickness. So we want to preserve those supplies. We want to minimize interaction between and among residents, and especially those coming from the outside, as well as staff. So we have, until further notice, at least until April 1st, have closed the Aquatic and Fitness Center. That includes the pool, the jacuzzi, the weight room, the cardio room, the classroom where group fitness courses are presented, and also the integrated therapy room where one might receive a massage therapy, etc. Staff will still be working in the Resident Life Enrichment Department to plan ways to enrich resident lives other than through Aquatic and Fitness Center activities and through group activities that might occur, such as events, larger events. So we are ceasing all large group events, both internal and external. That includes resident gatherings, large group staff gatherings. There has been a question about what is the appropriate size, and the real fact is any number that is placed to curtail large groups is arbitrary, because one person can share the virus with one other person. As far as other restrictions go, we will be asking all staff to check in all areas of the campus, not just in Woods, Cedar Court, and Southwoods Lodge, but there will be infrared thermometers taking the temperature of staff in all departments each day to make sure that no one is reporting to work with a temperature as previously shared. The communication to residents will occur through several means. One is through this video that will hopefully be either posted onto the Hillcrest website or made available to residents digitally and in another way. We have an emergency response line where you can receive updates to the virus by calling 909-392-4004. And for the residents at Hillcrest, you can just dial extension 4004.